When we get back,
yeah, we can talk about that too. That's exciting for us, and I think just for more services we're going to be able to provide, for everybody.
Cash markets are steady to down 1. Missouri direct butchers are steady to 1 lower. December 17th lower, 46.37, and February's down 30 at 53.77.
Still recovering from election.
John Perkins.
Yeah, I ended up staying up pretty late watching that on Tuesday.
And Minnesota again continues with Dr. Eric Stroemer. We were just discussing the elections earlier this week. He's as in shock as the rest of us are about the outcome and a number of the races, particularly the presidential race. But we're going to talk more with the good doctor. I promise we won't talk politics.
Good,
thank
goodness.
We're going to talk about
my wife warned me this morning to not do it. So.
Okay, yeah, no, we won't touch on politics. We will talk about the good doctor, and there's some exciting news in the practice too. I mean, some really exciting news coming down the pike here from the Orthopedic and Fracture Clinic. How's that for a teaser? Stay tuned.
Oh, it's my commercial.
Top quality personalized care. I'm Dr. Eric Stroemer of the Orthopedic and Fracture Clinic. I'm an experienced board-certified surgeon. I specialize in minimally invasive joint replacement and sports medicine. If you need my help, visit ofc-clinic.com. We'll take
That's going to change.
every step of the way. The Orthopedic and Fracture Clinic. Better care, better value.
Good Dr. Eric Stroemer is in our studio today. If you'd like to ask your questions, head to the Facebook page here, facebook.com/KDHL Radio. I do have a link on a posting I did on our website, KDHLradio.com, about today's show. All you have to do is click on that link. You go right to the Facebook page, ask your question. We'll be sure to ask the good doctor about that question. As I note on there, I did a little posting saying that asking a question is as simple as checking out your Facebook page. Just that simple. Isn't technology amazing, Doctor?
It is, and I think it appears people are on their Facebook page quite a bit, so it should be pretty easy. Yeah.
Well, that's what I'm thinking.
Hopefully not while you're driving, though, please.
No, well, I don't think you could. Could you?
Well, I think a lot of people are checking their Facebook while they're driving.
Well, that's not good.
No.
We don't want people to do that. Anyway,
No.
Facebook.com/KDHL Radio. Yes, the good doctor's right. Make sure you don't do it while you're driving.
Correct.
Well, you've got some exciting news to share, Doctor.
Yeah, it's not any. Unfortunately, it's not a new medical breakthrough. Excuse me. But our group has decided to join or merge, if you will, with a larger orthopedic group from the metro area called Summit Orthopedics. In the metro area, there's really only 3 orthopedic groups left. Summit Orthopedics, Twin City Orthopedics, and Tria Orthopedics. So those really are only 3 orthopedic companies left in the metro area. And as Faribault and Northfield and everything is kind of evolving more into the South Metro, a lot of pressures from various things with insurances and hospitals, things like that. We felt that it was going to be good for us to team up with a bigger and better team. I'm excited because we're still going to have our same clinics down here, but now we're joining a group that has a lot of spine specialists, foot and ankle specialists, hand specialists, these kind of things that I would normally send you to the metro for. And I am hopeful now we can work something out that we'll have some of these specialists come to us in Faribault and see people here locally, and won't have to make people travel. This is all starting January 1. So January 1, our name is going to change, but we're all still going to be the same doctors, same nurses, same clinic. Just going to have a different name on the shirt. So pretty exciting stuff. I think it's going to really bring us into the kind of the big leagues here with these groups that can really offer a lot more specialties. I think some people were worried that if they had never heard of Summit Orthopedics, that it was just some big corporation. But this is a doctor-owned, doctor-run company of about 30 orthopedic surgeons. So we're going to be able to be partners and on the board, and we're not going to change anything. We want to continue to provide the same affordable, great care and be, approachable and accessible as much as possible. So
Yeah, I'm glad you put that in there because, bigger's not always better.
correct. Oh no, I agree. I mean, I think you probably get way better personal service at one of our, State Bank of Faribault or Reliance Bank than you would at, one of these big banks that are having all sorts of problems. So, as long as I definitely think people appreciate the feel of, a smaller company that still cares about you as a person.
I promise not to bring up politics, but I guess I'm kind of forced to here. Is Obamacare kind of driving this?
No, Obamacare more is unfortunately probably hurting a lot of the small businesses and middle class people with their health insurance plans. So I don't think that's really driving this. What's driving this is just that everybody wants to have affordable care and better access, and there's just different models to provide that. And it appears that really, you see these hospital systems around the state, the Fairviews, the Alinas, the Mayos, they're buying up all the hospitals and they're buying up all the primary care practices. So, I think this was the best move for us to join a bigger orthopedic company with like-minded physicians like us that put the patient first and also try to really do it affordably and be able to prove that we provide better results actually for better prices.
Yeah. Everybody says they put the patient first, but not everybody does that. And you guys have received a Patients Award, right?
Well, we definitely, this year we did receive the Business of the Year Award from the Chamber of Commerce, and that was, I believe, through some type of online process or even a Facebook drive. So we didn't have anything to do with that, and people had nominated us, and I think that really goes to show probably more our employees are just really our nurses and our schedulers and our front desk staff. They know everybody. They take the extra 5 minutes with you. They stay late at work to make sure people get their callbacks. So, I think we try to keep it as a family, kind of a family company, and I think that pays off in the end.
If you'd like to ask a question, you go to our website, kdhlradio.com, and click on the link that I have in a post there, or you can go to just facebook.com/kdhlradio and ask your question of Dr. Stroemer. I thought we'd touch on today, the fall season is coming up. I mean, falling down,
yeah, gravity.
Winter.
Yeah.
I hate to use the word winter, but it's going to come sooner or later.
Yeah, I mean, geez, it should, hopefully, but yeah, so this is a season where we definitely like to warn people and just have them think twice about everything. If they're up on ladders, cleaning their gutters, this is good gutter cleaning season. So, really, if you're going to do it yourself, you really want to make sure that your ladder is proper, that the footing where the ladder is proper, that you're not doing it quickly, because I got to tell you, I don't know what it would cost to pay someone to clean your gutters, a couple $100. The bill when you fall off your ladder and break your leg is way more than that, and that screws up your job, that screws up your life. I'm not pitching any gutter cleaning services either here. I just think that we don't want to see people get injured like that. If you get injured doing something fun that you love, that's one thing, but you definitely need to be careful out there, because some of those falls from ladders are life-changing, and we can fix some things, but some things you end up never the same again. So just think about that when you're out doing that stuff this fall. The other thing too is we see a lot of overuse things when everyone's out raking their leaves and pruning their shrubs and all these kind of things, and you see a lot of overuse injuries. So your shoulders, your elbows, your wrists, you want to maybe dial it back a little bit, rest a little bit, maybe even take some Tylenol or ibuprofen if you're going to do something like that, and maybe even ice something afterwards, just so you don't end up in our office, because we see that a lot.
Ice is an amazing healing tool, isn't it?
Yeah, I tell you, ice and aspirin, I think, is all we need, really. I mean, all the other medicines, I don't know.
And aspirin was never approved by the Food and Drug Administration, right? Isn't that what I read?
Well, there's a lot of there's a lot of what they call off-label uses for everything. So, but yeah, aspirin sure seems to be a good anti-inflammatory, protect your heart, and really with minimal risks. So again, I'm not going to preach any cardiac health stuff because I haven't read about that stuff in a decade.
I did put some gutter leaf guard gutter helmet type devices on my gutter, so I no longer have to climb up on the ladder and do that stuff.
Yeah, they should maybe that should be their new marketing slogan is avoid breaking your leg, get helmet gutters. Yeah.
I never thought about that. You might want to consult
Maybe I
them
should talk to them. Yeah.
Some kind of a campaign.
I've thought about that too, because when I look out my window, I can see some of my gutters, and they're pretty dirty. So. The other thing about this time of year is we're starting to get to the winter season too. So you definitely we start to get out the snowblower education too about really never putting your hands anywhere near the running snowblower, things like that, because that's one of those injuries too that you just never seem to get better from.
Well, a couple of years ago, I took a nasty spill on the ice just outside the radio station here. I ended up with a physical therapist and getting all kinds of treatment on a knee that I sprained my meniscus.
Yeah, I mean that's I always wonder what the orthopedic surgeons in Florida do all winter when we're dealing with all these injuries, because we have slips and falls on ice, snowmobile injuries, all that stuff. So you got to be, you want to be careful, but you don't want to walk around on eggshells and just be worrying all the time. Most of the injuries that you might sustain, we can help get better, and a lot of the times it's just a matter of resting it properly, bracing it properly, and rehabbing it properly. It will have nothing to do with a surgery or anything.
No, well, with my sprain, they couldn't do anything surgically, so I ended up having to go to a physical therapist. The first thing he did was have me bring all my shoes.
Yeah.
He starts tossing them off to the side. What are you doing? He said, you're going to have to get rid of these. Really?
Huh.
Yeah, the soles on these just aren't good enough. So.
Yeah, I mean, that just basic, soles on your shoe is kind of like the tread on the tire of your car. Everyone in Minnesota knows you don't want to drive with bad tires in the winter. Well, you walk more than you drive, so you definitely should think about your footwear. You got to take care of your feet. If you don't take care of your feet, they won't take care of you. So you should think about your shoe wear in the winter, kind of like the tread on the tire of your car. You get what you pay for there, and definitely I don't need anyone falling anymore and breaking wrists. We have plenty to do this winter, so we want you to be safe.
After that visit, I went right down to Burkhardt's Myers, got me a pair of new winter boots with good soles on them.
Yep, yeah, exactly. And we're lucky here, again, I think I've mentioned this in some past interviews, that Burkhardt's Myers, we're kind of lucky to have an actual shoe store where people, been around forever, and they actually know what they're doing. Yeah. You go to the store at the mall in Burnsville, you got a high school kid selling you some Nikes. So, I find them as a great resource to help with people and their footwear stuff around here.
Yeah, they can put in
they have orthotics, the inserts and stuff. They can help with all sorts of things. A lot of times when people get older, their toes get a little off, and we need different kinds of shoes so they don't rub. So I've found it to be a valuable resource for our care.
Just think of all the miles you put on your feet.
Yeah, I mean exactly. I think that's how I always tell people, you got to take care of your feet and your back, because if you don't, it'll come back to haunt you.
Yeah, there's nothing, I don't think, anything worse than back pain.
Correct. Yeah, I mean that happens to over 90% of people on this planet at some time in their life will develop pain in their back. So it's something that you are going to have at some point. just how you deal with it and how you manage it, and then how to make sure it doesn't happen again is really the keys. And that's where hopefully us and our physical therapists and dietitians and all that can kind of come in handy to kind of help get you on the right program.
It's interesting you bring up dietitians too. We're understanding more and more, aren't we, about nutrition and its importance in our health.
Oh, correct. Yeah, I think just the basics of just the amount of calories we put in and the obesity problem, things like that, that's really going to stress your joints and your back. But I mean, they're getting even the stuff where there's certain foods that may be more pro-inflammatory in your body versus others. So there's certain foods that may make your joints hurt more. So it's all real new, and there's nothing concrete yet. But I definitely feel that whatever you put in your body, it's going to affect it some way.
One of the first things that you recommend when people come into your office, if they're a little overweight, is maybe to lose a few pounds. Is that right? Or
yeah, I mean that's a hard discussion to have
have
with people, and it's a lifestyle thing. People always say, well, I can't exercise because this hurts or that hurts. Well, it turns out once you fix someone, a lot of the times they don't change their lifestyle and they don't exercise, they don't do more exercise. So I try to tell tell people that you need to change your lifestyle, your eating habits, things like that, your sleeping habits, before anything surgically is really going to help you, to be honest with you.
Yeah. I mean, the surgery, if you end up with the same lifestyle, it's not going to work.
Correct.
I mean,
yeah.
temporary fix.
And what we do with giving people new hips and new knees, there's definitely good data to suggest that the heavier you are, the longevity of your prosthesis goes down. So, if you're 55 and we want this to last the rest of your life, yeah, the lighter you are, the better. Some people even, they lose that 20 pounds, their joints feel good enough that they don't, they put it off, which is great.
There's a certain age, right? I mean, you don't want to do these too soon, like a hip replacement or a knee replacement.
Well, yeah, so the old saying was wait as long as possible. Well, then you end up, maybe going through your whole age 60 to 70 kind of in pain and avoiding things. And so there is kind of a sweet spot for hip and knee replacements, and that's kind of mid-60s, because in mid-60s it should last you your whole life when you have it done. You're still usually healthy enough to recover from the surgery and the rehab without too much issue. That being said, if you're 55 and your hip is completely bone on bone and it's limiting your ability to work, have fun with your family, etc., and it's the only option left, then yeah, we still give people a new hip when they're 55.
They'll probably have to have another one, and the second one isn't as...
Yeah, when you redo things, it is technically more difficult because of scar tissue and whatnot. But now that I'm getting older, I start to think, well, would I rather have, a better life from 55 to 75 and possibly need a new hip then, or do I want to deal with a bum hip for 20 years and then get it done? So I'm changing my tune as I get older here, and
a lot of us do.
Starting to realize that I think quality of life is important. So that's where, again, I've said this before, is I really try to get to know people and know their lifestyle. I'm not just a mechanic. If your mechanic started asking you all sorts of personal questions about where you drive and how you drive, you'd probably get a little offended. But I like to know these things because I kind of need to give you advice on how these implants might treat you.
Dr. Eric Stroemer from the Orthopedic and Fracture Clinic is our guest this morning on AM Minnesota. You can go to facebook.com/KDHL Radio and ask your question. By the way, when I went to Italy last April, not this year, but April of 2015, one of the women on our trip had just had a knee replacement.
Okay.
She had a cane the whole trip. She had just started rehab right before the trip, so the timing was not great. We do a lot of walking. Never heard her complain once.
Really?
No.
Oh, good for her. Well, I don't know if I should say this publicly, but women tend to be more tougher than men with a lot of these surgeries. Yeah. So I wouldn't doubt that for a minute if she was probably hurting, but
I would guess she was taking, ibuprofen.
yeah,
whatever.
maybe even some pain pills if it's that early. I mean, the first month after a major joint replacement, people need some pain pills sometimes at night, and we like people to get off them as soon as possible because there's a lot of downsides to being on those longer. Yeah, I can imagine that. If I was going to do a knee replacement on someone, I would usually advise them to hold off on any trips for 4 weeks, or wait and do it after. Maybe give them an injection and get them through the trip, and then come back and do it. But
if you've been to Italy, I mean, it's a lot of walking on cobblestone and
right.
that sort of thing.
I've never been. That's on my bucket list to visit there someday.
It was terrific.
Yeah,
I would
good
go
pasta,
back.
good food.
Oh, the food is incredible. Yes.
Yeah, that sounds. That's definitely on my list one of these days to make it there.
I'm sure you will. So again, folks, if you do have a question, you can certainly ask us. We had touched on the fact that the Orthopedic and Fracture Clinic is not going to change the practice whatsoever. You're just getting bigger, which means more specialists.
Correct. Yeah. So January 1, the commercials will change a little bit, and our name is going to change on our shirt and our name tag. But we're going to be the same doctors, same nurses, same schedulers, and it's going to be exciting. I think we're going to be able to really improve access to care here in the Faribault area. We're hopefully going to be able to improve specialty care in Faribault, and I think hopefully enhance our care of people instead of having to send people to other places because we didn't have that specialist. So I'm excited. I think it's going to be great.
I only have a couple minutes left in the show. On a bit of a personal note here, I have arthritis.
Mm-hmm.
And I don't know, as I get older, it seems to be getting worse and spreading in terms of joints in the body. You got any recommendations for what a person can do?
Arthritis, as of right now, tends to slowly get worse. It just is kind of how you decide to manage it. Any joint that has arthritis, we recommend you want to keep it mobile. So you always want to keep it moving. You also want to keep the muscles around that joint stronger. The stronger they are, the better that they can tolerate the arthritis. And you also just have to have some reasonable expectations that even Michael Jordan had to hang up his sneakers at one point, so you might not be able to hit the home run as far anymore. And if you have some reasonable expectations, there's no reason why you can't do most things till you're 90 years old, really. I would say
it's just a matter of living with the pain.
Yeah, I mean, I would say definitely, a little bit of aerobic kind of stuff, going for a walk or riding a bike every day.
Yep.
The jury's still out on the over-the-counter glucosamine chondroitin supplements, the over-the-counter cartilage supplements. The data coming in is always a little inconclusive, so the policy statements are, we don't know, essentially, but I have a lot of patients that love it. Staying active, eating healthy, dropping a couple pounds, and keeping those joints active is really going to be the key.
There we go again. Gotta have good nutrition. Hey, thanks, Dr. Stroemer. Appreciate your stopping in today.
All right, sorry I was late, everyone, okay. And thanks for having me.
Dr. Eric Stroemer with the Orthopedic and Fracture Clinic here in Faribault. That concludes today's edition of AM Minnesota on KDHL AM Faribault.